Next up, I'd like to introduce Dr. Sofia Villagran, who is visiting us from Chile. Welcome on up. And she'll be talking about expanding dermatology access in remote Chilean communities.
Thank you, Carrie. Well, good morning to everyone. My name is Sofia Villagran. I'm a dermatology resident in the Pontificia Universidad Católica de Chile, and today I want to talk to you about breaking barriers and expanding dermatology access in remote Chilean communities. So here we have a map of Latin America, and this long, narrow country that you see here is Chile. So our country spans 4,300 kilometers from north to south, and we have very diverse climates and terrains. Our healthcare system is divided in a public part, that's FONASA, and a private one, that's ISAPES. Around 40% of our population lives in Santiago de Chile, that's the capital, and our countryside is geographically dispersed. As you may see, we have very diverse parts of Chile, from the north to south to islands all around our country. So what's the problem? The problem in Chile, we divided it in three parts. The first one is the scarcity of access to dermatology services. We have 500 dermatologists around the country. That gives a ratio of 2.9 per 100 inhabitants. In second place, we have an unequal distribution, with 64% of them concentrated in the capital city. And the regions with the lowest availability of dermatology services are 44 hours per week, and that's Antofagasta and Arica y Parinacota. That is a total of 44 hours for around 700,000 people. In third place, we have an inequity between the public and the private system, with a total of 162 dermatologists in the public system and 52% of them in the capital city. So, what's our project? Our project is to create outreach programs in Spanish, Operativos Dermatología UC, to expand access to care and by helping people to reduce waiting lists in dermatological consultations and also in surgical minor procedures. So here we have the 4 outreach programs that we have done since 2023. The first one was in San Pedro Atacama, then in Pichilemu, Coyhaique, and Futrono. Futrono was just last week, so we saw 130 patients and we did 10 minor surgical procedures. I wanted to talk a little bit more about Coyhaique. Coyhaique is the biggest outreach program that we have done until now, and the first one also that we start collecting data. That's what I wanted to talk to you a little bit more about. In first place, we saw not only new consultations, but also we saw controls, and so in total we did around 250 consultations. The waiting time was reduced from 300 to 400 days to 210. That's almost 100 days less than the media in Chile. And our final outcome was that we changed the diagnosis of half of the patients that we saw, and also we discharged around 30%, so they don't need any other consultation but by dermatology. So here you have some photos of our team working in different parts of Chile and also doing surgical procedures. And here you have photos of our workshops. We also do educational workshops for patients and also for GPs. And here in the corner in the right, you may see the Sala de Espera Interactiva. That was something that we acquired last year from my mentor, Isabel Casas, and was really funny for the patients. They were being educated at the same time they were waiting for their consultation. So here you have a photo of our team. As you may see, we are many dermatology residents and all the dermatologists that work together in order to bring dermatology to different parts of Chile. And I want to thank my team and also invite you to be a part of it. If you want to come to Chile, we'll be very happy to have you there. The next outreach is next week in Coquimbo and then in October in Arica. And to finish, I want to thank my mentor, Isabel Casas, for all the guidance this year, and of course, thank GLODERM for this amazing opportunity. Here you have our Instagram page. That's our Instagram page if you want to follow us and talk to us through it. Thank you.